I've had 2 MRIs for my endometriosis and 2 completely different readings. Here's what you need to know about MRIs when it comes to the investigation of endometriosis symptoms. I'm going to get personal with you and share my MRI experiences where MDT involvement was missing and then magically appeared. Firstly, with MRIs, radiologists can take various approaches. You have your standard MRI where they just roll you in as normal. You have the use of contrast dye, which helps highlight your organs and areas of inflammation. Then there's buscopan, which is a drug used to help relax your bowel, to stop it from spasming during the scan. And finally, you have rectal fill MRIs. Saline is instilled into the rectum before your scan starts. This procedure may be used if you're suspected to have endometriosis around your rectum. Well, thank fuck for rectal fills, because finally my endometriosis miraculously appeared. Check out this report. There are some low-stranded adhesions visible between the left lateral margin of the cervix and the adjacent lower rectum, with several thick bands of fibrosis extending between these two structures, with further fibrotic band extending on to the posterior aspect of the left side of the vaginal vault. So rectal endo detected, check. Now this hospital didn't feel that my case was surgery worthy, so I moved on, forward on 5 months later, and I have another MRI at another hospital. The report reads, left endometrioma, there are 2, no bowel or bladder endometriosis, stable thickening of the uterosacral ligament, benign right ovarian cyst. So unfortunately, I had 3 new cysts on my ovaries. But as you can see, no bowel endometriosis. So I go back to the gynecologist, endo specialist, and share the other MRI results. A couple of months later, I get a letter. Your case has been reviewed through our endometriosis MDT meeting, and our radiologist has added an addendum amendment to the MRI report describing a possible 12.8 millimeter area which could represent rectal wall endometriosis. Both of these MRIs took place under the care of so-called endometriosis clinics. Both have access to multidisciplinary teams. But this is the reality of healthcare. Even when you're finally in the right hands, you have to force their hand to take appropriate action with your case.